back to the channel for We Talk Mental Health. As always, my name is Karen, your handy dandy, awesome, slightly awkward mental health advocate and social worker. Thank you so much for clicking on today's video. If you haven't checked out the rest of our videos, I will put the link in the description below. Today, we are continuing down the road of diagnoses, and we are going to be talking about trauma and stress related diagnoses. So, as always, I have my best friend here with me. I did take some notes so that I wasn't just flipping through some pages, but everything that I talk about comes straight from this and also experience. And before you ask, if you are wondering, yes, I am wearing an NSYNC t-shirt because it's awesome. I feel like it should be, maybe it can become a thing where I just wear random t-shirts and while we talk about super important, super serious mental illnesses and mental health topics, because I think that it makes it a little bit more fun. And not that I'm not taking it seriously, but this is who I am, and I think it's important to be who you are when you're putting things out there so that people know that I'm not just some like super serious social worker. Because I think that when you're engaging in like a mental health community, the more open and honest about who you are as a provider, and especially with your clients, I think that that's really important. Maybe we'll make it a thing. What kind of t-shirts does Karen wear on the videos every week? Give me a comment or a like if you think that that is a good idea. If not, we'll just keep wearing whatever. It's fine. But I thought that this was fun. It has their faces on it. It's great. Anyway, back to the discussion. So today we are talking about trauma and stress-related diagnoses. They are very common, and everybody at some point in their lives experiences some sort of trauma, but it doesn't mean that a person who experiences trauma is going to develop a mental illness associated with that trauma. So in today's video, we're going to be talking about reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, and adjustment disorders. Let's jump in. So trauma is a response to a deeply distressing or disturbing event that overwhelms an individual's ability to cope. It causes feelings of hopelessness and helplessness, diminishes their sense of self, and hinders their ability to feel a full range of motion, as well as hinders their ability to function normally. So some examples of trauma would be childhood neglect or physical and sexual abuse, but as well as adult sexual assault or physical assault, natural disasters, accidents, torture, domestic violence, and obviously combat, and that's one that's really important to me. About 1/3 of 125,000 people from 26 different countries had experienced trauma in their lifetime, which seems like a really small amount when you really think about it, but I think that it would, that's documented and that's reported, so I think that it could be potentially a lot higher because there are a lot of people who don't talk about their trauma. There are 5 major classifications of diagnoses underneath the umbrella, and they are reactive attachment disorder, disinhibited social engagement disorder, post-traumatic stress disorder, acute stress disorder, and adjustment disorders, as well as, per usual, the trauma-related to medical condition or substance abuse, other specified and unspecified. So, and this is one of the most important things that I want everybody to take from this video. Before we even get into the diagnoses, I want you to remember this one thing, and this is so important. It is that trauma is defined by the experience of the survivor. So something that was traumatic for you might not be traumatic for another person, or vice versa. And it does not take away from what you've been through as a survivor of trauma. Your trauma is not any worse or less severe than somebody else's. If it was traumatic for you and it causes you significant distress, then it is a trauma. It is something that has changed your life. And scientifically, there's been a ton of research that shows just how much trauma changes the chemistry of the brain. I'm not great at inserting different images, but I'll try as the video goes to show you the effects of trauma on a brain. The difference is pretty staggering. It's hard to ignore the fact that trauma changes people, and it changes the way that we respond, and it changes our emotions, and it's super, super important that we learn about them so that we can treat them more. And the brain is just so complex, and there's still so much that we don't know about it. So the more that we learn and the more research that's done, the more is coming out about trauma-related diagnoses and, you know, treatments that can be really helpful, and we'll talk about that. So the first diagnosis that we're going to talk about is reactive attachment disorder. It's a consistent pattern of inhibited, emotionally withdrawn behaviors towards adult caregivers, which can be described as rarely or minimally seeks comfort when distressed, or a child rarely or minimally responds to comfort when distressed, and it persistent in social emotional disturbances characterized by minimum social emotional responses to others, limited positive affect, episodes of unexplained irritability or sadness or fearfulness that is evident even during non-threatening interactions with adults. And these types of behaviors are caused by pattern of extremes of insufficient care as evidenced by social neglect or deprivation in the form of persistent lack of having basic emotional needs met, and it's or repeated changes to primary caregivers. Disinhibited social engagement disorder is a pattern of behavior where the child actively approaches and interacts with unfamiliar adults. So there's like a reduced absent awareness of approaching or interacting with unfamiliar adults. It doesn't kind of register to that child that that's not a safe thing to do. Or they're overly familiar or verbal or physical behavior, which is when it's not socially appropriate with, you know, people that they don't know. Or a diminished sense of checking back with adults after venturing off is also a characteristic of disinhibited social engagement disorder. And the reasons that are characterized for the disorder to develop are the same as in reactive attachment disorder. So it's typically caused by minimal interactions with primary caregivers. When a baby is born or a child, you know, is growing up, that sense of comfort that they find with an adult is just not there, and they have no appropriate way to gauge who is safe and who is not because they haven't had a steady and a stable relationship with a caregiver, whether it's been traumatic or not. So the third diagnosis is post-traumatic stress disorder, and it's diagnosed within approximately 8.7% of the US population, and it's actually more common in women than in men. And I think that part of that is because of the stigma associated with mental health, not only in the military aspect of soldiers coming home and not wanting to talk about their mental health, but also just because of men in general. The stigma associated with talking about their feelings and dealing with traumatic experiences that they go through. So take that kind of statistic with a grain of salt. In order to have this diagnosis, has to experience these characteristics and symptoms for at least 1 month, and they can be diagnosed in a person if they've had exposure to an actual or life-threatening event of death, serious injury, or sexual violence in one or more of the following ways: direct experience to a traumatic event, witnessing a traumatic event as it happens to another person, learning that a traumatic event has happened to a friend or a family member, or repeated extreme exposure to a traumatic event. So if a person has experienced any of those situations, they have to have at least one intrusion symptom, at least one avoidance symptom, at least 2 cognition or mood symptoms, and at least 2 arousal or reactivity symptoms in relation to the event or object or situation. And an intrusion symptom is considered flashbacks or dissociative reactions, bad dreams, frightening thoughts, or distressing memories about said traumatic event. An avoidance symptom is avoiding places or events or objects that remind the person of the traumatic experience, avoiding distressing memories or thoughts about the event or closely related to the event. So cognition and mood symptoms are characterized by trouble remembering key features of the traumatic event, negative thoughts about oneself or the world, distorted feelings of guilt or self-blame, loss of interest in enjoyable activities, persistent negative emotional state, inability to experience emotions, and feelings of detachment or estrangement from others. And arousal or reactivity symptoms are irritable behavior or anger outbursts, either verbally or physically, recklessness or self-destructive behaviors, hypervigilance, exaggerated startle response, problems with concentration, and sleep disturbance. So a person has to meet certain areas within those 4 different characteristics in order to have a diagnosis of PTSD, and the person has to be experiencing them for at least 1 month. In children under the age of 6 years old, so if a person is over the age of 6, they can meet those typical symptoms are what we look for. If a person is under the age of 6, some of those symptoms could be apparent, but we also look for things like bedwetting or regression, forgetting or being unable to talk, acting out the scary event during playtime, and unusually clingy to a parent or guardian or caregivers. Acute stress disorder overlaps with post-traumatic stress disorder. Look for all of the same symptoms, but the difference is that a person who has experienced a traumatic event experiences these symptoms from within 3 days to less than a month, and not any more than we would consider the diagnosis of acute stress disorder. The thing about trauma and the thing about these diagnoses is that a person can begin to show symptoms either, within a couple of days of the traumatic event or years later. There's no real diagnostic criteria that we look for in terms of a time frame. It's just how long the person has been experiencing the symptoms of the disorder. So the next one that we're going to talk about is adjustment disorder. It's a development of emotional or behavioral symptoms in response to an identifiable stressor occurring within 3 months. The characteristics that we look for is marked distress is out of proportion of severity or intensity of the stressor, and there's a significant impairment in social, occupational, or other important areas of functioning. There are specific identifiers that we look for with adjustment disorder, so it can either be with depressed mood, with anxiety, with mixed, so depressed mood and anxiety, disturbance of conduct, or with disturbance of emotions and conduct, or unspecified. So when we talk about treatment for a trauma and stress-related disorder, there's a lot of evidence that supports that trauma-focused therapies are very, very effective, such as trauma-focused cognitive behavioral therapy, or TFCBT, which I am trained in, and I love it. It's such an exceptional framework when you're working with kiddos, but also for adults. And there's been a lot of scientific research conducted with specifically veterans who've experienced trauma from combat, and the use of EMDR, which is eye movement desensitization and reprocessing, which is a fascinating evidence-based approach to helping trauma and reworking the inner wirings of the brain. The thing is that oftentimes people can experience more than one trauma, so as they're going through therapy and working through one trauma, and you start to get to a place where you're ready to kind of stop and go back and talk about it, another trauma can pop up. And you, as a provider, you have to be really well trained in working with a client through potentially more than one trauma and how that's going to impact their functioning, because it can re-traumatize a person. And I don't want to just, push CBT and EMDR. I do really truly believe that it's effective, but I've also seen a lot of research and heard from a lot of people that hypnosis and trauma sensitive yoga and art therapy, acupuncture, there's a lot of kind of holistic ways to treat trauma. And as long as the person that you're going to is really well trained in trauma focused treatment, you'll be fine. You have to be ready to deal with the trauma. You can't force somebody into treatment for a trauma, because that can be traumatizing in itself, but we're there with you to help you work through it. As always, medication can be really helpful as well. It's typically an antidepressant or an anti-anxiety medication that's prescribed in order to help manage the symptoms. Next week, we're going to talk about post-traumatic stress disorder and complex post-traumatic stress disorder, which is not technically a diagnosis in the DSM-5, which is why I didn't talk about it today, but we'll talk about it next week in next week's video. So I really appreciate that you've watched this far. If you have, I hope you learned something. As always, if you have any questions, please don't hesitate to reach out to me. All of my social media handles will be linked in the description, and if you want me to keep wearing awesome t-shirts, tell me. Like the video. Anyway, I am rambling. Thank you so much for watching. I hope that you all have an incredible week, and I will see you next time. Mwah.